Hey everyone, it's Being Healthly, and welcome back to the channel. Did you know that ginger consumption in the United States has increased by over 250% in the last decade? From ginger shots to ginger teas, this potent root has become a popular home remedy for everything from nausea to inflammation. While ginger has many health benefits, there are certain situations where ginger consumption can actually do more harm than good. So, before you start adding ginger to everything, it's important to be aware of the potential risks. In this video, we're going to explore 10 health conditions where you might want to avoid ginger. Make sure you stick around until the end of the video because we're going to cover some really important information about how ginger can interact with common medications. So you might be asking yourself, how can something as harmless as ginger affect my heart? Well, while ginger is generally considered safe for most people, it can pose a risk for those with heart conditions. One of ginger's main compounds acts as a natural blood thinner. For those with heart conditions, especially those taking blood-thinning medication, ginger can amplify the effects of these medications, leading to an increased risk of excessive bleeding. Ginger can also lower blood pressure. For those already on blood pressure medications, consuming ginger can cause a sudden and drastic drop in blood pressure, which can lead to dizziness, fainting, and in severe cases, even more serious complications. Always consult with your doctor before adding ginger to your diet, especially if you have any concerns about your heart health. They can assess your individual risk factors and advise you on whether ginger is safe for you to consume. Remember, when it comes to your heart health, it's always better to err on the side of caution. Now, let's talk about diabetes, a metabolic disorder that affects millions of people worldwide. If you or a loved one has diabetes, you know how important it is to keep your blood sugar levels in check. Ginger, while often touted for its health benefits, can actually complicate blood sugar control, especially for those with diabetes. Ginger has been found to have hypoglycemic effects, meaning it can lower blood sugar levels. The combination of ginger and diabetes medications can cause blood sugar levels to drop too low, leading to a condition called hypoglycemia. Symptoms of hypoglycemia can include dizziness, confusion, weakness, and in severe cases, even seizures or loss of consciousness. Adding ginger to your diet can disrupt this balance and make it more challenging to manage your diabetes effectively. If you have diabetes and enjoy ginger, it's essential to talk to your doctor. They can monitor your blood sugar levels closely, adjust your medication dosage if needed, and help you incorporate ginger into your diet safely and effectively. Let's move on to another common condition, gallstones. Gallstones are small, hardened deposits that can form in the gallbladder, a small organ located just below the liver. While some gallstones are asymptomatic, others can cause excruciating pain and discomfort. Ginger is known to stimulate the production of bile, a digestive fluid that helps break down fats. For those with gallstones, increased bile production can actually do more harm than good. When the gallbladder contracts to release bile, gallstones can block the bile duct, leading to a backup of bile and causing a sudden onset of intense pain in the upper right abdomen. If you have gallstones or have experienced gallbladder problems in the past, it's best to steer clear of ginger. Always consult with your doctor if you have any concerns about your gallbladder health or if you're experiencing any unusual symptoms. They can provide personalized advice and help you make informed decisions about your diet and lifestyle. Blood disorders. For individuals with blood disorders like hemophilia or von Willebrand disease, where blood clotting is impaired, ginger can pose a significant risk. Ginger contains compounds that can thin the blood and prevent clotting. For those with bleeding disorders, it can worsen their condition and increase the risk of excessive bleeding. Even a small cut or injury can become difficult to control, and internal bleeding can occur more easily. Introducing ginger into the diet can interfere with medications to promote clotting and make it harder to manage the condition effectively. If you have a blood disorder, it's essential to talk to your doctor before consuming ginger in any form. They can assess your individual risk factors and advise you on whether ginger is safe for you. Remember, managing blood disorders is crucial to prevent complications and maintain overall health. Pregnancy. Pregnancy is a special time in a woman's life, a time of immense joy and anticipation. While ginger is often recommended to alleviate morning sickness during pregnancy, it's crucial to consume it in moderation and under the guidance of your healthcare provider. Ginger has been traditionally used to induce labor, and while more research is needed to confirm its effectiveness, it's thought that ginger can stimulate uterine contractions. During the early stages of pregnancy, consuming large amounts of ginger could potentially increase the risk of miscarriage or preterm labor. Every pregnancy is unique, and what works for one woman may not be suitable for another. That's why it's crucial to consult with your doctor or midwife before adding ginger to your diet, especially during pregnancy. They can provide personalized advice based on your medical history and ensure the well-being of both you and your baby. Gastrointestinal issues. Ginger is often praised for its ability to soothe nausea and aid digestion. However, for some individuals with pre-existing gastrointestinal issues, ginger can actually exacerbate their symptoms. Ginger can relax the muscles that control the lower esophageal sphincter, the valve that separates the esophagus from the stomach. This relaxation can allow stomach acid to flow back up into the esophagus, leading to heartburn and indigestion, especially in those prone to acid reflux or GERD. Ginger can stimulate the digestive system, which can cause gas, bloating, and diarrhea in others, particularly those with irritable bowel syndrome, IBS, or other digestive disorders. If you experience frequent heartburn, indigestion, or other digestive discomforts, it's essential to pay attention to how your body reacts to ginger. Start with small amounts and gradually increase your intake to assess your tolerance. Always listen to your body and consult with your doctor if you have any concerns about your digestive health. Allergies. While ginger allergies are relatively uncommon, they can occur, and it's important to be aware of the signs and symptoms. Just like any other food allergy, a ginger allergy is triggered by the body's immune system, mistakenly identifying ginger as a harmful substance. Symptoms of a ginger allergy can vary from person to person, but common signs include skin reactions such as itching, hives, or eczema, digestive upset such as nausea, vomiting, or diarrhea, respiratory problems such as sneezing, runny nose, or wheezing, and in severe cases anaphylaxis, a life-threatening allergic reaction that can cause difficulty breathing, swelling of the throat, and a drop in blood pressure. If you suspect you may be allergic to ginger, it's crucial to avoid contact with the root and seek medical attention immediately, especially if you experience any severe symptoms. Medications. Ginger's potent compounds can interfere with the way certain medications are absorbed, metabolized, or eliminated by the body, potentially reducing their effectiveness or increasing the risk of side effects. For example, ginger can interact with blood-thinning medications like Warfarin, also known as Coumadin, and increase the risk of bleeding. It can also interfere with medications for high blood pressure, diabetes, and heart conditions, making them either too effective or less effective than intended. Even over-the-counter medications like aspirin and ibuprofen can interact with ginger, potentially causing gastrointestinal bleeding. It's crucial to inform your doctor about all the medications you're taking, both prescription and over-the-counter, as well as any herbal supplements or vitamins, before incorporating ginger into your diet. They can assess potential interactions and advise you on the safest course of action. Surgery. If you're scheduled for surgery, it's crucial to inform your doctor about any medications, supplements, or herbs you're taking, including ginger. Ginger has blood-thinning properties and can increase the risk of bleeding. Most surgeons recommend discontinuing ginger consumption at least 2 weeks prior to surgery to minimize the risk of bleeding complications. Following surgery, it's equally important to follow your doctor's instructions regarding diet and supplements. They will advise you on when it's safe to reintroduce ginger into your diet based on your individual recovery progress. Clear communication with your healthcare team is essential to ensure a safe and successful surgery and recovery. Kidney stones. Kidney stones are hard deposits that form in the kidneys, often causing excruciating pain as they pass through the urinary tract. While ginger is generally considered beneficial for kidney health, in those prone to kidney stones, it can actually increase the risk of stone formation. Ginger contains oxalates, naturally occurring compounds found in many plant-based foods. In susceptible individuals, they can bind with calcium in the urine and form kidney stones. If you have a history of kidney stones or are at an increased risk due to family history or other factors, it's essential to moderate your ginger intake. Your doctor or a registered dietitian can provide personalized recommendations based on your individual risk factors and help you make informed choices to support your kidney health. So, there you have it. 10 health conditions where you might want to avoid ginger or at least consume it with caution. Remember, while ginger offers numerous health benefits, it's not a one-size-fits-all remedy, and it's crucial to be aware of its potential interactions and side effects. Always consult with your doctor or a qualified healthcare professional before adding ginger to your diet, especially if you have any underlying health conditions or are taking medications. Now, I want to hear from you. Have you ever experienced any side effects from ginger? Share your experiences in the comments below. Until next time, stay healthy.